Hi, I'm Dr. Vikram Rajguru. If you're watching this, you are likely trapped in a cycle of neck or back pain that simply refuses to go away. You may have been diagnosed with spondylosis, disc bulge, degenerative disc disease, or sciatica, or something labeled as tech neck. You have tried painkillers that upset your stomach, physiotherapy that feels just good for a short time, braces or belts, or a treatment that worked briefly before the pain returned. And yet here you are, still dealing with stiffness, radiating arm pain, headache, sciatica, lower back pain, difficulty sitting or turning in bed, or the pain that wakes you up at night. And at some point, a thought crossed your mind. Is this my life now? Will I eventually need surgery? Why does this keep returning? Let me begin by telling you two important things. First, it's not your fault. Second, what you were told about your diagnosis may be technically correct, but incomplete in terms of causation. Traditional system focuses entirely on the disc. Your MRI shows a disc bulge, so the disc becomes the villain. However, the research shows that more than half of the adults over the age of 40 have disc bulges, but no pain whatsoever. So, if the bulge is not always responsible, what is? The real issue is instability caused by weakened ligaments. Let's make it simple. Your neck supports a head that weighs around 5 to 6 kilos. Your low back carries the full load of your upper and lower body. Both are held together by ligaments which function like seat belts. When those ligaments weaken due to posture habits, prolonged sitting, lack of core strength, or previous injuries, micro shifting begins between the vertebrae. This micro movement irritates the nerves, triggers the inflammation. When this happens in your neck, muscles tighten as a protective brace. Pain travels into the shoulder or down the arm. Headache begins. Mobility decreases. Sleep gets disturbed. When this happens in lower back, disc bulge more than before. Nerves get irritated. Sciatica develops. Sitting becomes painful and bending forward becomes risky. Here is what you need to understand clearly. Muscle spasm is not the problem. It is your body protecting instability. If you relax protective muscles with massages or medication, but you don't fix the instability, pain will always return. If you reduce inflammation without increasing stability, pain will return. If you wear belts and reduce functional muscle support, pain will return stronger later. To fix this at origin, stability must be restored. At Healing Waves Clinic, we use a proprietary system called the 360-degree spine restoration program. This covers your both neck and lower back conditions. I personally trained a specialized team of experts to execute this protocol with precision. We begin with a detailed kinetic and structural assessment. This defines whether your neck problem originates from your shoulder asymmetry, whether your low back pain originates from pelvic imbalance, core insufficiency, or facial tension. We don't just treat only the symptom location, we treat the root cause. After this, we begin the E-star protocol. The E indicates the enhanced regenerative version because it integrates advanced systems like focus shock wave therapy, high intensity class 4 laser, electromagnetic tissue stimulation, quantum molecular regenerative fields, and resonance-based tissue activation systems. These are not superficial physiotherapy machines. They stimulate deep regenerative activity inside the ligaments, connective tissue, helping them regain structural tension. Once structural enforcement begins, we combine it with our regenerative rehabilitation. This is where stabilizing muscle architecture is developed. We built deep core strength, pelvic stabilizers, cervical stabilizers, and the postural load-bearing capability. This transforms the body from reactive protection mode into the natural stability mode. This approach is used with the athletes and the high-performance professionals internationally. We have brought that same standard to India while keeping the treatment accessible financially. More than 15,000 of patients have been benefited with this protocol. Many were advised surgery. Many depended on painkillers. Many lived with recurrent symptoms for years. Their recovery did not come from symptom relief. It came from biomechanical correction. That being said, If you have advanced nerve damage, bowel or bladder dysfunction, paralysis or severe foot drop, surgery may be appropriate. It is important to acknowledge that. However, most individuals with chronic stiffness, disc bulges, radiating pain, recurring spasm do not require surgery. They require stability. At this point, what you need is clarity. I invite you to book a comprehensive spine assessment with my team. We will interpret your MRI from a mechanical lens and evaluate ligament behavior, segment by segment stability, neuromuscular compensation, and risk progression. Don't wait until numbness becomes permanent. Don't wait until pain begins limiting movement or confidence. Click the button below, schedule your assessment, and let us identify the real driver of your pain and correct it at its root.